Standing in front of the White House after a visit this morning with Dr. Ryan Stanton, who is the president-elect of the American College of Emergency Physicians. What's happening here today in Washington? Why were you at the White House?
Well, we're here today to celebrate an investment in rural healthcare in the United States, so the rural transformation healthcare. And the importance of that is the fact that the majority of this country is in fact rural. And we firmly believe that just because you have a different zip code doesn't mean you get a different health care. That wherever you choose to live, that you get the same quality, high-trained emergency medicine-based care, getting the specialists that this country and the emergency departments deserve. When you see that red sign above the door, people should know and expect that they are going to get the best care possible. And for me, being somebody that's grown up in rural America, between Tennessee and Kentucky, this hits home to me. This is very important because I know these people. I grew up with these people. These are my family, my friends, my neighbors. And so for me, this hits home as something that's very important for all Americans across the country.
So based on that experience, what kind of impact do we think we'll see here? How much can this money help?
Well, I think focused, purposed money is very important. The one thing I love about this is that it's meant to go to the states for the states to determine where that money is focused. So it's not a global federal government-based project that says Alaska, Kentucky, New York all get the same plan. It's very specific to those states and the needs and challenges they faced. For us in Kentucky right now, facing potential scope expansion, but understanding the fact that we are within about 30 minutes at any given moment of a level 1 trauma center by air is very different than being in Idaho or Montana or Alaska, where help may be hours, if not days away. And so can we specify the funds, the targets, in order to get the best outcomes?
So you like the thought that was put behind this and giving everyone a chance to plan it their way?
I absolutely do. I think the key here is to not only to restrict a little bit of the corporatization and the consolidation of healthcare, but also then turn it back over to the physicians and the patients to say this is what we need, is to build around the relationship of a physician and a patient to get the best outcomes. The expertise, training, degrees, and everything that comes with being a physician, a patient that is there in need and needs assistance, care, or some type of planning, we can provide those resources and get them where they need to be.
Thinking 5 years into the future, looking back on this moment today, the money will have been spent by then. What do you hope will have changed in that time?
I hope that when I'm getting close to retirement and I'm moving out to the country somewhere to watch sunrises and sunsets, and God forbid something happens, that when I go to the emergency department, I'll look up and be face-to-face with a board-certified emergency physician that's there in that setting, committed and invested in the community to take care of me and my friends and family and everybody else that's there. That's what it's all about. You shouldn't have to live among skyrises and large buildings to get the best possible care. We want to make sure that we are delivering emergency medicine to the people where they live.
Dr. Stanton, appreciate your time today. Thanks for coming to Washington.
Thanks, man. Appreciate it.